this week's numbers, on Tuesday, as we came back from the holiday, we announced there were 28 cases that were new to Chautauqua County that took place from September 5th through the 8th. And the more remarkable piece was there were 58 individuals that completely recovered. And that brought our total active number of cases on Tuesday to 114. On Wednesday, there were 12 new cases to report. Yesterday, there were 16 new cases to report. And we were at a total of 124 active cases of COVID-19 in Chautauqua County. Today, we have 8 new cases to report in Chautauqua County, but what I think is important also is that we have 98 active cases, which means we had 26 cases fully recover from yesterday to today. Those new 8 cases have 6 cases in the 1st Battalion, that's the Dunkirk-Fredonia area in the northern part, towns of Hanover, Silver Creek, and Pomfret. We have no new cases in the 2nd Battalion, which is Brockton, Mayville, Westfield, Ripley area. We have 1 case in the 3rd Battalion, which is the southern part of our state, the towns of Harmony, town of Bustye, Lakewood, city of Jamestown, West Ellicott, and Frewsburg. And 1 case in the 4th Battalion, the area of Falconer, Kennedy, Ellington, Gary, Cherry Creek, that eastern part of our county. We also have 470 individuals under quarantine or isolation orders by the Public Health Director and continue to be monitored. And we have 252 individuals under the domestic traveler quarantine for having arrived in Chautauqua County from the state listed on the New York State Travel Advisory List. I urge everyone, if you're planning on traveling, that list had changed in the middle of the week. Ohio was not on the list. They are now on the list of the travel advisory. They went back on. Another key number to look at is the number of hospitalizations as of the 9th of September. We have 2 individuals hospitalized in Chautauqua County with a diagnosis of COVID-19. And we want to remember that our capacity for our hospitalizations is 253. So again, well below our intended capacity. Today we've had 450 fully recovered cases. Unfortunately, we still announced 10 fatalities and a total of 558 total confirmed cases. Another number that's going up is 38,013 negative tests for COVID-19 returned to Chautauqua County. As we continue through this pandemic and evaluate our local situation and processes, we are announcing some changes in today's case reporting. With the governor's new mandate for school districts to report cases within their district, the county will begin reporting positive cases by zip code effective Monday. As part of this change, we will no longer report the age and gender of our positive cases. Our earlier decision to report by fire battalion was made in unity with counties in the Western New York Public Health Alliance, except for Erie County, due to the large population that they have there. After early instances of threats made against individuals who had tested positive and protecting patient privacy, we moved to share the information via our fire battalions. The directive now from the state to the schools, along with a recent uptick in positive cases, will allow us to give a more specific but general location without fear of violating the HIPAA laws or breaching patient privacy as we announce our positive cases. The disease is here in our communities, as we have said, and we all still must remain vigilant and cautious to prevent that spread as much as we can. After today's press conference, we will also return to holding our COVID-19 press conferences on an as-need basis. The full daily updates will continue to be reported Monday through Friday, and the number of new confirmed cases only will continue to be reported on the weekends. At this time, I would like to turn the microphone over to our Public Health Director, Ms. Christine Schuyler.
Thank you, County Executive Wendell. Our epidemiologist, Bree Agate, has been able to compile a significant amount of data for us regarding what we've seen so far with COVID-19 in Chautauqua County, and I'd like to share some of that with you. This will also be made available to the public through our website as well as our Facebook page. From March 24th through September 9th, 2020, there have been a total of 534 cases of COVID-19 of Chautauqua County residents. We have had 10 deaths, which is 1.9% of that, and 6% of persons have been hospitalized, or 32 cases. In discussing the current situation of SUNY Fredonia, I can assure you that we've been working diligently along with the health center at SUNY Fredonia to contain the spread of COVID-19 within the SUNY community. 84 total students have tested positive for COVID-19. 30 of those students are now recovered, and we have 54 active cases related to the college. We also have been working diligently since day one on the COVID-19 situation related to Foodbrook Foods. To date with this cluster, there were 82 confirmed cases. 61 of those cases were employees. 57 of those 61 employees have fully recovered. 4 of those are remaining active at this time. 21 community contacts were also quarantined related to Foodbrook Foods for testing positive. All 21 of those close contacts have recovered. Bree was also able to look through the symptoms that people have suffered related to a COVID-19 infection. What we can tell you so far, as of the same time period, March 24th through September 9th, in our total of 534 cases, 71% of individuals showed at least one symptom of infection, meaning 27% had showed no symptoms whatsoever. Out of those 534 cases that we had, 6% or 32 persons were hospitalized. 477 or 89% were not hospitalized. We have missing or unknown data on 25 of those persons, or 5%. A lot of that is related to county residents. We also went through what the symptoms were that people have been experienced related to COVID-19, and the number one symptom that people complained of out of our cases in our county, the 300 and total with symptoms, 316 out of 381. Cough was experienced by 168 people, or 53%. Headache was next, followed by fatigue, fever, and then muscle aches. There is a long list of symptoms here, broke down by numbers and percentages, which we will be made available for you to see. Bree also broke this down by age group. We'll have this graph available. It really shows a pretty even breakout of symptoms amongst all age groups. So I thank Bree for all of her hard work, along with Macy Delahoy and the rest of the support staff who have been helping to compile and analyze all of the data for us as we move through this. As County Executive Wendell said, we will be starting on Monday reporting our existing and positive cases by zip code. We feel that we have a high enough number of cases now that we're able to report that by zip code instead of just fire battalion as we have. It's our public health responsibility, yes, to inform the public, but number one, preventing the spread of communicable disease, but doing so in a way that protects the privacy of those who are infected by communicable disease. So that really is why we're changing to our reporting by zip codes. As the county executive mentioned, we are also working very closely with the schools, who are now required to submit data daily to the state health department regarding number of COVID positive students or staff or volunteers or anyone within their school buildings. We are doing our best to support them. The local health department is also required to report, but that's something we do regularly and right along anyway, so there really isn't a new mandate for us, but we will be having very clear and comprehensive communication between my public health nurses and the school nurses to assure that everyone is aware of any positive students, especially within a school, and that the confidentiality of that student and their family is maintained. In addition to that, one of the many resources that have been developed for schools to utilize with their reopening was a COVID-19 screening flowchart. All school resources are available on our website, and some of them, such as the screening flow chart, will also be available for you to see on our Facebook page. I'm sure you can't see it here, but we'll be able to see it in more detail later. This screening flow chart was created by us, and then we really got a lot of input from several of our local physicians and pediatricians as to testing and return to school recommendations and when to notify your primary care provider and what direction to follow. We in Chautauqua County, along with every other pretty much state in the union, or in the county and the state, are following a symptom-based return to school and work. A negative COVID-19 test has not been required by this public health authority to return to school or work, and that is the same going forward with schools. We are awaiting clarifying guidance from the state health department, just so we have that in writing. It has not come yet, but I'm very hopeful that it will be coming very, very soon. I fully admit that I forgot my notes today, so I'm doing the best I can with remembering my long list of updates I had for you today. One of the important things, though, is that we're very fortunate in Chautauqua County that we all get along really well, for the most part. We work well together. We've established some really great collegial relationships over the years, and that really has been evident during this pandemic. One very recent display of that is just this morning. We've got word from Reverend Luke Footer at St. Luke's in Jamestown. And Reverend Luke really has taken a lead with the faith-based community in assembling support and resources for those who are in isolation and quarantine, who are having difficulty having their basic needs met. That does fall onto us as the county health department to provide, and we've had so many people in need that the church community has really stepped forward as far as the organizations and the members of the churches, and I have just been overwhelmed with the response and the support that people are putting forward to really help those in need in a very, very difficult time. I'm forever grateful. I think that's something very important to note on this very solemn day of remembrance. The most important thing is that we're all in this together. And it is absolutely not a time to point fingers and blame and point out things that could be done better or should have, could have, would have. We're in the here and now, and we have to embrace one another, even virtually, and provide some support and continue to get through this in the very successful manner that we have so far. Thank you.
Thank you. At this time, I'd like to turn the microphone over to John Griffith, our Director of Emergency Services.
Thank you, County Executive Wendell. Through the past 7 months, I guess, that we've been doing this, the Office of Emergency Services has worked very closely with Christine Schuyler and the Department of Health. And as a logistical support piece for that, I'm very pleased to report how well it's gone. Christine mentioned the relationships that we have. You know, there's a lot of backroom things that have happened over the past few months, and a lot of events and a lot of participants. You know, I can honestly say, in being proud to be in the position that I am, that at no time did I ever mention to someone that I needed something, that I was even questioned to say no. It was, are you sure that's all you need, and what else can I get you? I can think back to when we had the fire coordinator staff delivering COVID supplies out real early to fire departments and to other agencies, and we did our initial testing and set up at Chautauqua School and at Faulkner School, and we had the fire police team there doing the traffic control, and we had the law enforcement through the local law enforcement coordinated through Sheriff Quattrone to put that piece together. It was phenomenal. All the way through, and we got to Fieldbrook Farms, and that was Fieldbrook Foods, I'm sorry. We got to be a little bit more, and we needed a little more staff, and I picked up the phone and I called the other agencies in the county. I called All-Star and said, could I get a couple of paramedics to do some swabbing? And the answer right away was yes. Do you need two? Do you need more than that? I said, O2 will be fine. I called Fredonia Fire and said, Chief Brian Walker, could I get someone to help swab? He says, I'll come do it myself. He's a paramedic. And he came. You know, this county is fantastic in the way that it can come together and work together. And I think it's fitting on today when we talk about 9/11 and we talk about the first responders and the heroes of New York, that we have that here in this county, and we have Christine for the help that we've been able to work together on. And thank you, everyone. Thank you.
Thank you. All right. At this time, we will open up for questions. Again, we'll allow 2 questions for our media. And you can go ahead and unmute your phones at this time. We'll start right at the top with Dave O'Connor from Chautauqua.
Thank you, PJ. Christine, you released a lot of information, and I took notes as quickly as I could, and I know this is recorded so I can go back, but again, all of that information you released, and then all of the information that PJ released about the new kinds of reporting, that will all be on the county website under the health department and also under the health department's Facebook page, and then recapped in an Amanda Gallagher email later today, I would say.
Yes, Dave, that's correct.
Okay. That's all I have. Thank you.
Thank you. Moving on. Dennis Phillips from the Post-Journal.
You mentioned there are 4 active cases for Philbrook farms or foods. Out of 82 cases overall, do you think the spread of the infection when it comes to that manufacturer has basically ended?
I think that it definitely was a cluster, we'd call it, or an outbreak. I think it has been under control now. I think between the additional precautionary steps that Philbrook has put into place, as well as increased vigilance on the part of the employees themselves, I think that we've been able to control the outbreak within that facility. That doesn't mean that we're not going to ever have any more cases there. I mean, there are cases in various businesses and various locations throughout the county, and that's because COVID-19 is here. Some employers, such as Philbrook Foods, require that any employee who shows symptoms must be tested. Then they also require that a negative test happen before you even come back to work. So there are cases here and there all over, and when it gets to a point that we need to do further steps, such as we've done with Philbrook, then that's when that happens.
From what I understand, the active case numbers for Fredonia have decreased the last day or two. Do you think that's more under control than it was, let's say, a week ago?
I hope so. I think that once we got through the first week or so of school reopening and so many of the off-campus parties and various things that were going on and cracking down on local bars and establishments in the areas, I think we have seen. I'm hoping that we're over the hump with that. The other thing to note on the numbers out of SUNY Fredonia, not all of those students are county residents, which is a little different than our normal reporting, but for the state health department, we as Chautauqua County, we count all of the students at SUNY Fredonia, whether they are their home residence is in Chautauqua or not. Let's say you could live in Cortland County and attend college at SUNY Fredonia. We're going to count that as one of our cases. So that's a little different nuance than what we usually do with some of this reporting.
Thank you very much.
Thank you. Spectrum News, Mark Goshgarian.
Thank you. Chris, I wanted to ask you about Memory Garden. Can you tell us what actually happened there, how many cases there were, and is this sort of probably the first time that we've seen our healthcare system, for lack of a better term, sort of impacted by this, or how would you characterize that?
I didn't bring any notes with me on that. I do believe that the administration of Tanglewood came out to say that I think there were three residents that tested positive at Tanglewood, and a couple of their staff members. I think what's really nice is no one has been critically ill out of any of those affected in that long-term care facility. They are abiding by the requirements, using PPE. There have been a few cases here and there throughout our county. We've had at other long-term care facilities. I truly think that's to be expected, just given what's going on with COVID-19. The state health department gets immediately involved with any long-term care facility or hospital or group home or anything that the state is the overseeing agency of, such as a long-term care facility. So they go right in and make sure that everything is being followed, that things are under control, and work with us on that. So I think we're going to have little clusters such as that here and there, and I think that's to be expected. We just have to be very vigilant, that we can keep that under control.
Next question that I have is regarding community colleges. It's interesting that places like Fredonia and UB and other larger universities have all these cases, yet none of the community colleges, and I hope I just didn't jinx it, but either in Jamestown or Olean or any of our other community colleges in the viewing area don't have any cases. So what's your reaction and response to that, and what you might attribute that to?
I hope you just didn't jinx anything there, Mark. Well, I think one of the main factors is you have we're seeing colleges where they have a lot of on-site, living, dorm living, but also a tremendous amount of off-campus living. So there's a lot of intermingling there. The community college has more commuters, and not so much communal living and sharing of things. SUNY Fredonia was one of the SUNY schools that was already doing the testing in pooling. So they were already, that's how the first positive case there had been identified, was through these pools. JCC now is also going to start doing that pooling. So they are going to be taking a closer look at their own school population moving forward with that pooling of testing. So we'll see how that goes. JCC, we have met regularly with them throughout the summer and during their reopening to ensure that their plans have been in place and that they are following by all of the requirements and the guidelines. I think some of that is just a difference in that, college town mentality of young people gathering and such, versus a community college that's more of commuter-based learning.
Great. Thank you.
Moving on, WDOE, Mr. Dave Rowley.
Well, good afternoon, everyone. Wanted to get a little bit more info on SUNY Fredonia. And Christine, maybe you have some thoughts. But does it appear that the number of cases has stabilized at the campus? Because looking at your figures and also the dashboard at the campus, it seems the total number of positive cases is up, but active cases have actually dropped by quite a bit. Your thoughts on that situation?
The drop in the active cases is directly related to when people either became symptomatic or were tested if they were asymptomatic and have been released from isolation. We saw, a big spike when school first started, and then also with the rapid testing that was available that many students took advantage of. So as students have recovered, they fall off of that active list and are able to be released from isolation. I honestly don't know if that's going to be the end of it or not. Excuse me.
Anything new also on the rapid testing machines that the state has loaned to the county? Anything new there?
Well, yes. I can tell you that in order to do any sort of point of care testing, which is what is done with this this analyzer, is an Abbott ID Now molecular analyzer. You must have a lab license through the state health department. We do, as the county health department. We have a limited service laboratory license. We had to apply to the state to have that testing added to our license because we've never had that before. So we have made that application. And then we also have never done this sort of training before. The state of New York actually doesn't own these analyzers. Health Research is a company that owns the machines, and it was on contract with the state. So each of us counties who are getting the machines have to enter into a memorandum of understanding with the health research company in order to utilize the analyzers. So we can't take possession of those analyzers until those memorandums of understanding are completed. So all of those pieces are in process, and once that's all completed, we as my staff and John Griffith with Emergency Services and Mike Pease at the Chautauqua Center have been planning on how to best utilize those analyzers. I also have to submit a plan to the state health department and Wadsworth Lab, who is our contact for these machines. Our plan really is once we have identified an outbreak or a cluster somewhere, then we will be utilizing that rapid technology in order to quickly identify anyone who's positive that we can and get them into isolation, get their close contacts identified and quarantined as quickly as possible. So I really see that's the best use of rapid technology, especially because the supplies are limited that come along with those analyzers that the state has provided to us. So it's definitely a work in progress.
Okay. Thank you very much. Appreciate it.
Thank you. All right, moving on. Media One, Terry Frank.
Good afternoon, folks. Christine, you brought up a lot of data, a lot of numbers that BRIAG has been able to work on. I was given a set of numbers earlier, and I actually kind of verified them. Dennis Webster, who likes to do such things, mentioned to me that looking at the data for the last month, the number of cases in Chautauqua County, confirmed cases, has more than doubled. What kind of concerns do you have as we go forward? We're going into the flu season and such. Articulate what people should be thinking about right now.
I think the increase that we've seen in the last month is directly correlated, especially to SUNY Fredonia, and also to the outbreak that we had at Fieldbrook Foods. So I think that tells people that when people are in close contact and not taking precautions, that there will be spread of disease. Our schools, pre-K through 12, have reopened. I'm not alone in my concern that we will see increase in pediatric cases. I've been working closely with David O'Rourke through BOCES and our school superintendents, ensuring that they are doing everything that they can to keep children safe at school, but to also make sure that they're getting the learning that they need. I think it's important for us all to realize that this is another community issue. We have to be very mindful to try to balance the pandemic that we're in with the other societal issues that we've got going on, where there's been an increase in the state central registry reports of suspected child abuse and neglect just within this last few weeks. We expected that with schools reopening. We're not really sure how that will unfold and what that is going to mean. But in addition to that, we are continuing to see that's a lot of overdoses out there. There are a lot of people in need. So there are a lot of storms going on at the same time. And I think it's just emphasizes all the more how much we all really need to work together for the greater good.
I know one issue that was going on early in the pandemic was the issue of contact tracing. You talked about that a moment ago, Christine. And I was wondering, with the recent cases, the increases and such, have you been seeing more cooperation in terms of people with contact tracing?
I don't know if it's more or less. Most people in general are very cooperative with us when we call. It really is the outliers out there, as in everything else in life, who are not as cooperative. My hat really goes off to our public health nurses and support staff and the other staff that have been pulled to public health to assist us from other areas of the Department of Health and Human Services, especially because all of those active cases that you see, anyone who's positive, is monitored by our staff. When it comes to after the public health nurse does the original investigation and walks through that with the person who was tested positive and identifies all of the close contacts of that person, enters all of that information into the state system, then the virtual contact tracers through the state health department then can follow up with those contacts. But that person who's tested positive remains our case for us to do all of that follow-up with. So the higher that number of active cases are, the more people that our nurses alone, just about, are following up on. So that's when you saw the real high numbers of active cases there. It really, I don't know how they've done it, and I am so appreciative of the long days, 7 days a week, including over the holiday weekend, that my staff has put in order to really make sure that people are monitored in their isolation and quarantine, but also that all their needs are also met.
Very good. Thank you, folks.
Thank you. And now, Jason from WRFA.
I would like to thank my colleagues for asking all the questions. I have no further questions for today. Thank you.
Thank you. You know,
I thought of a few things that were on my other list that I just kind of wanted to update you on. One of them is that we have issued some cease and desist orders. So there are some, especially bars, restaurants, that were determined to not be abiding by the state's guidelines, especially as it's related to wearing masks. So those cease and desist letters have gone out. Gym inspections was a new requirement on my environmental health staff. Our public health sanitarians have taken us on, and as of 20 out of 20 gyms have been inspected. A 21st gym has not opened yet, but that's being inspected today, and hopefully we'll be able to reopen. So that will make 21 the number of gyms that have requested to reopen during this time. Sadly, there are some gyms as well as some restaurants that have not reopened or have chosen to close their doors, related to, sadly, the consequences of the pandemic.
thank you. Just to recap, we can't say it enough, especially on a day today when we thank those first responders, but I think our unsung heroes are public health nurses who, again, behind the scenes, and many times when criticisms have come out and said our local health departments aren't doing the job, I would beg to differ with our staff here and the tireless work that they have done throughout this entire pandemic. And the use of our virtual contact tracers through the state has been very limited, not because of anything more than the ability of our group to do an outstanding job and to not be overburdened. Although when we did see our travel quarantine go up, we did utilize our contact virtual tracers from the state. But I can't say enough about the staff here in Chautauqua County and what they've done. And as John Griffith had mentioned, the unity and collaboration that we have had is second to none. The point, missions were made during the week, our public health, Christine Schuyler and that department was working hand in hand with 17 school districts, working hand in hand with SUNY Fredonia, with JCC. So as we are moving into this new year of the school year, the work has been done and the legwork and the groundwork has been established. And that is to be commended, obviously. And we've shared that several times. So SUNY Fredonia received a commendation or a congratulations from Jim Malatras, the SUNY Chancellor. Part and parcel is what we've done to help them. And they know that as well. They're very appreciative of everything we've offered them. But I just can't, again, say enough of how everyone has united here in this county. We have worked together. We have shown our resilience. We have shown how to do things in a disciplined way. So again, I really would like to thank everyone. But we're not out of the woods. I don't want people to think that, oh, okay, this is, our press conference will be as needed, and we're hoping they're not needed. We're hoping we don't see another cluster. But if we do, we have that plan ready to go. We have things in place that we've had in place already, and we'll just keep doing what we're doing. We will get the numbers out as we've had in the past. Ironically, questions have been made about numbers and what we put out. We can't withhold the numbers. The numbers come on our eclairs, and if we're not following up on those numbers, then we get a call from the state saying, what are you doing? So, again, the numbers are out. I feel it's important, along with my team, my COVID response team, as you've seen, that the information will be there for our individuals in the county. But we like to remind everyone that we are still in this together. We still must wear our masks when we are in public and unable to socially distance. We need to avoid the large gatherings. We need to do what we have done from the very beginning. And we need to do it with the same vigilance and the same dedication and discipline we started on March 16th and continue now through the month of September and on into whenever we get the lift and saying we can go back and start to go back to life without a mask. I don't know. When that day is, we're not sure. We'll take each day as it comes, and we'll get over any hurdle that is placed in front of us. But I'd like to thank everyone who's been participating in these press conferences all along. As we said, our new reporting starts Monday, but we appreciate everybody who's been here. And stay healthy, stay safe, and as I've said before, continue to be CHQ strong. Thank you.